So menopause can have a significant effect on people's sex lives. So first of all, there are physical changes that take place. So vaginal dryness or soreness might make sex impossible. Urinary symptoms and recurrent infections might make you not want to have sex. Hot flushes and sweats at night. If you're lying in a pool of sweat, you might not necessarily want to get sweatier. And your libido can change, so the actual desire can change. And that's often due to testosterone deficiency. So I think to boost libido, there are various things actually. Number one is to make sure that physically you feel okay. Because obviously if you've got severe vaginal dryness or soreness, it doesn't matter how much libido you have. If it's very painful, it's something that you're not going to necessarily want to do. And the other thing is testosterone deficiency affects a lot of women after the menopause, and testosterone replacement therapy can be very helpful for women who have got lack of libido as part of their menopausal symptoms. So I think when we talk about libido, it should be for everybody. It's not just for people who have a partner. So if you don't have a partner, don't just park your libido, celebrate it. Go and buy yourself a vibrator, ladies. Everybody should have one. So look, there are health benefits to having sex. It's good for your heart. It lowers your blood pressure. It helps you sleep. It boosts your immunity. It can help with vaginal dryness. So by increasing the blood flow to that part of your body, it can improve not only your vagina, but also your bladder. So there can be improvements in pelvic floor health. And of course, it's good for relationships as well, is to maintain that closeness between couples if that's what they want to do.